I think for me, I would like to see a different world. If you are out of the country, you see completely different scenario. And for me, is that I would like to go to the place that there is no doctors. Then we can really help the people in need. Afghanistan, as we know, is a war-torn country, so the health system is very fragile, and after many years of war, there are not enough medical facilities and medical staff. So that's why I come back again and again, because there is need. We need to support the people there. I got a huge family influence, because when I was a child, you know, one of the books, my favorite books was Human Anatomy. It's weird. But then, yes, I think they taught me a lot about, you know, the principle of doctors. You need to help your patients, and then you work for the people, not for money. The most is the willingness, you know, for them to have a better life, and then the willingness to learn, especially women, because most of the time I worked with women. In those contexts that, you know, as a woman, it's difficult to receive full education to become a physician or midwife, and then it's also very difficult for them to continue work while they need to raise their own children. So I was very much impressed by their willingness to learn all these new techniques, to learn from us, and then in the meantime to have a balance with their work and personal life. Definitely, you can see the improvement, because years ago it was difficult to find a female doctor, also midwives. But nowadays, if you go to Midwives Regional Hospital, you will find out the full team, all these young girls, they got education, they become like physicians and midwives, and they serve back to their own community. So first of all, you need to protect yourself. You know, we call duty of care. So before you treat any of the patients, you need to make sure that you are not infected. Because if medical staff is sick, which means nobody will take care of all the patients. So second of all, we need to make sure that all the medical supplies are available in the hospital. So you know, you have only doctors or nurses is not enough. You need to have drugs, equipment. So we need to make sure that everything is in place. The government assigned another hospital as a COVID-19 treatment center. Also, ICIC supported that hospital, you know, for medical supply donation. But then in Midwives Regional Hospital, we are focused on prevention. Because you never know who you get contact to. So for us, we try to keep the emergency services and obstetric services running as usual. There are a lot of discussion and operations on COVID-19, but I would say what we saw in Afghanistan is that we need to really maintain the essential medical services to the people in need, because you know, if you count the number of deaths, probably the children died due to measles and other infectious diseases, and the women died because of pregnancy. The number is much more than the deaths of COVID-19. So for us, we were working on the daily activities in the hospital to make sure that the hospital still can run as much as possible, so that people can come to our hospital to seek for medical care.